Lights out.
Welcome everyone once again for another fantastic episode of SleepTech Talk, the sleep podcast, with your hosts and friends, Emerson Kerr, Robert Miller, and me, Dr. Jerry George Mannikarote. We're here for you for all your sleep needs, sleep talks, sleep what have you. And to tell us about what we have, I want to hand it off to Robert. Robert.
Absolutely. Thank you, Jerry. So we have with us today Dr. Erin Elliott. Some of you who are on social media have probably seen some article or maybe even presentation that she's done in the industry of dental sleep medicine. We thought we'd bring a little bit of a different topic than what we've traditionally covered, which are things that are sort of really specifically related to the sleep lab. And we wanted to venture out and talk a little bit about the dental sleep medicine world and maybe how sleep labs can get more involved in the world of dental sleep medicine. So Dr. Elliott, if you would tell us a little bit about yourself, and thank you for being here.
Oh, yes, it's my honor. So real quick, I grew up in Orange County, California. Not necessarily a small town, but I went away to college on a soccer and academic scholarship in the middle of nowhere, near Buffalo, New York. So about as far from California as you can get, and met the husband that's still my husband there, and got married and went to Creighton Dental School in Omaha, Nebraska, and graduated in 2003, and then beelined to Coeur d'Alene, Idaho, way up in the northern part of Idaho in the Panhandle, and started practicing, and I'm still there and an owner partner in Post Falls Family Dental. But I also have Sleep Better Northwest, and I basically discovered that dentists could be part of a patient's journey for a better night's sleep in 2008, and immediately went to get trained. And I'll tell you that the cards are stacked against you, especially back then, as far as dental sleep goes. But I was persistent, even when I was told it doesn't work, you're gonna fail. I just knew that we were gonna help so many people. And of course, you see it everywhere on patients, and who better than dentists to be screening this, creating awareness, all of those things. And of course, we can help treat as well. So even I have to deal with medical insurance, not dental, but medical, and patients that tell me no, they don't have a problem, and sleep physicians that say appliances don't work, even though they have an HI of 6 with the appliance on. You know, we battle all these things, but I know it's worth it.
Hey, thanks for being with us. I'm totally jealous that you're in Coeur d'Alene. That has got to be one of the most beautiful places I've ever visited in my life. Gorgeous, gorgeous. So when you think about, being somewhat of a pioneer in this space, a lot has changed. So when you think about how you assess a patient and think about the solutions for, dental sleep therapy, what do you feel like have been some of the greatest advances for you in the technology to be able to provide, a better solution for your patient? Because a lot has changed since you entered that space.
Yeah, and for a while, one of the biggest hesitations for physicians, especially sleep physicians, is the fact that with a CPAP, if the patient actually goes and gets it, they're treated. They have the auto titrating and compliance, all that stuff. But with an appliance, you have to start them at a comfortable position. And so then you kind of advance and go back and forth from there, where you can find comfort plus efficacy. And you don't know that for probably a month before we retest. And so as far as technology goes, we did have a solution that was in the sleep lab, and then finally an at-home version in which you made temporary trays attached to a motor, and based off of the oxygen desaturation, or ODI, it would move you backwards or forwards while you slept to see if you were a responder, and if so, at what position. So it was kind of the solution that we were asking for, and physicians were asking for, but they actually during COVID went under. So that was a great technological advancement, and I hope they can revive it. because that was a useful tool. But we also have digital scans now. And so instead of the goopy impression material, because most sleep apneics have small mouths or gag reflexes, we basically take a video of their teeth and bite. And then we can email it off, and then the appliances are fabricated via digital. So the technology in the dental world is essentially milling or 3D printing appliances. So we get strength without bulk, essentially more room for the tongue, less protrusion, more comfort, and hopefully better efficacy. There's no study that proves that yet. However, it is logical. So that's some of them. And then also cone beam technology. So I take a 3-dimensional image of each patient that's getting an appliance, and new patients in my dental practice. I still practice dentistry, crowns, fillings, all that. And with that technology, I don't use it to screen. I definitely use it to start a conversation. But with an appliance, I can see the nasal obstructions, deviated septums, polyps, large turbinates, all of these things, because nasal breathing makes the appliance work better. Nasal breathing is healthier, but I can also set expectations like, hey, you may still snore because of these reasons, and we're going to meet your deductible. Why not consider an ENT referral so that we can make the appliance work better? So
it's funny you say that. Things. Well, it's funny you say it, because you're talking about a lot of great technology here, and I think sometimes one of the things we compete against in sleep medicine is the do-it-yourself patient. They think, I'm going to go get this boil and bite solution, and that'll move my jaw forward. And there's some challenges with that. So how do you really bridge that? Because sometimes in sleep it's hard. When so many people can be self-educated. About their disease and the solutions. So how do you create that value that you're able to really, kind of compete, for lack of a better word, against the do-it-yourself patient? How do you build that story to better success?
That's a great question. I would have to say I don't compete against internet appliances very often. I don't know if it's kind of a smaller town and I have a pretty big footprint that because I've been working on it for so long. And most of my marketing, I put in air quotes because it's kind of a 4-letter word in medicine, but most of that is to educate and let patients know that insomnia is not normal, and it's oftentimes sleep disordered breathing. High blood pressure and sleep apnea and snoring are connected. Sometimes I don't even say sleep apnea because people think I'm calling them an old fat man. But and actually I have a whole campaign that says sleep apnea is not an old fat man's disease. So saying that, I try to educate. And for some reason, the internet ones aren't really competition. But fortunately, if we mention it and the patient says, oh, I tried an appliance, it was so uncomfortable, my first question is, what kind? And it is logical that a custom oral appliance that's small and adjustable would be more comfortable. And fortunately, there is enough patients that would see the difference and come to me for help, even after failing an internet one.
Doc, that's really cool. And I have some stories about oral appliances, but we'll save it for another time. Two things that you said really struck a point. One, you talked about how one of those technologies, how it kind of fell through because of COVID, and that's what the physicians really wanted. And number two was reaching out to the ENTs to help actually have it fit. So one thing we established, when I say we, is myself and my team back in the day, I was working with one of the med schools here in Houston, Texas, and we established a multidisciplinary approach, which included ENT, which included cardiology, included psychologists, as well as psychiatrists, and we also had dental sleep medicine. Is that the approach you guys are taking with your practice?
The Mayo Clinic approach, I love it. No, because there was an oral surgeon who did the maxillomandibular advancements and mandibular advancements, genoglossal advancements, all those things. And he is very passionate about helping people with sleep apnea. He tried to get that together. I would have to say that it's the medical world that just doesn't have time. If we could get 2 minutes with a physician and give them the elevator pitch of how we can work together, that's gold. That's gold. There's just not a lot of extracurricular time. And dentists tend to have a little bit more. So we're always willing to do that. But I wish we could, because it's unbelievable for the patients. But I also, you know, I still probably get called a little crazy because the primary care physician, who's not necessarily educated in sleep apnea, would say, oh, Dr. Elliot said that, she's crazy. There's no way you have sleep apnea. And say that just by looking at them, because they still think it's an old fat man's disease. So there's dental signs and symptoms that I look for that make it pretty obvious. So we're I say it's the time that we are battling at this point. It's not necessarily unwillingness. Yeah.
I know that insurance reimbursement can differ in different parts of the country and with different payers. And maybe that's part of a barrier, you know, in the past, that maybe sleep physicians didn't refer patients to a dentist for an oral appliance, even though it was another option other than CPAP, because they knew that, you know, insurance wasn't going to cover it. And, you know, I think that is definitely changing. Can you tell us a little bit about your experience as far as insurance reimbursement, what that landscape sort of looks like today, and you know, maybe our listeners will learn something about, you know, that would be helpful to have their sleep physicians order more oral appliances.
Yeah, so I get the opportunity to teach other dentists, and, you know, I do teach medical insurance, but that is such a paralyzing fear for dentists, because in dental insurance, you know, we say we're doing a filling and we get paid, even though we're getting more and more denials now. But when I teach, I say, you know, you don't have to have all these initials after your name. You don't have to be a diplomate. When you go to a physician to ask for referrals, the first question they ask is, do you accept insurance? And I think the medical world is so focused on insurance. And in the dental world, we're so used to selling, again, air quotes on that word, selling dentistry that people need that insurance isn't going to cover. And so, like, let's say Invisalign or ortho, you know, patients don't necessarily have insurance coverage, but we will sell a $5,000 case. And so we even teach dentists just to start fee for service, and don't let insurance stop you from helping patients. And we are, I'd say, pretty good at creating the value in what we're providing. And even though a custom oral appliance is more upfront, long-term, it doesn't have ongoing costs. So it's actually fairly a low investment. Saying that, we do bill medical for 95% of the cases we do. Payers, more and more, UHC, we have a gap number, we give it to them, then we spend a year trying to overcome the denial of the in-network. You know, I have to coach the physicians, because my sleep physician was telling the patient, well, it costs $3,000 and causes TMJ pain, but you could go see Dr. Elliot. I'm like, how many people are going to come see me? So it could go from $0 that the patient owes to, you know, $2,500, which we do very generous payment plans on. And so I had to coach the medical providers to let them know that we do not proceed without knowing you're out of pocket. We've billed enough for enough years that we can almost get it down to the dollar of what they would owe out of pocket. So that, I will tell you, is what is holding back dentists the most, and physicians, as far as referring. So I think the medical world focuses too much on insurance and not necessarily what the patient needs. So if I say, you know what, just refer them to us, we'll take care of it. We do not proceed or trick the patient without them knowing they're out of pocket. and you don't need to even say what it costs.
That's awesome. And I will say my dentist does drive a much nicer car than my medical doctor. So one of the questions that I really wanted us to get to, if you could sort of repaint the world of dental sleep medicine and how it interacts with the medical world of sleep medicine, do you have anything that you could give, our listeners that would be advice on, maybe how to even engage or start a conversation if you work at a sleep lab with a dental sleep specialist, in order to maybe you don't have the full Mayo Clinic, experience, but you could certainly begin to add more, parts to the puzzle that are involved in treating a patient. And I will tell you, I think that we are headed toward a world of AI in the future where phenotyping will identify patients who will never be compliant with CPAP therapy, and oral appliance would be the preferred method of treatment for that specific patient population.
Like the low arousal threshold. I cannot wait for phenotyping. I've taken a deep dive on that because I'm like, I just want the answer.
Yeah.
So as far as Mary, when dentists ask me like, what do I say to the sleep physician? I'm like, good luck actually getting them to talk to you. I was like, they usually have their mindset on appliances. Maybe you can get a few minutes with them to show them how the technology and the type of device has gotten smaller. We do have, more research coming out, but they usually stay on top of that. But what I do say is go hang out with the sleep techs. They love talking sleep, and you can go learn so much. Like I go and hang out and I'm like, oh, there's a K complex, I get a little nerdy about it. And then I bring black socks because the sleep tech always wore white, and I brought Swedish fish because he loves them. But I just kind of hung out in the lab, and then I provided a demo, and I offered even to make him an appliance so he could experience it and see what it's like. Same with the sleep physician. Fortunately, my local sleep physician, I think it's an Idaho thing too. He goes, back in Portland, all the patients would just go get a CPAP, like I asked. In Idaho, he's like, there's so many stubborn men. I said, yep, that's true. So he has to be more open to appliances. I think that the consumers now are more educated. When I used to bring up sleep to my patients, they would be like, why do you care? You're a dentist. And now they'll come asking their dentist to make them an appliance. So I think the consumer is changing and mentioning it to sleep physicians. And so they can't ignore it anymore. And I think the best thing that dentists can do is to get their foot in the door and even learn more is talk to the sleep techs and really show them how it would work. And I think a demo is a great way to do so because they're the ones kind of, helping the patient with the CPAP, and they're in the trenches with the patient. The sleep physician oftentimes, and Dr. Jerry, you can correct me, is just looking at the squiggly lines and not necessarily there in the trenches, like I said, with the patient. So I have even attempted to go talk to DME suppliers. I'm like, what do you do when the patient brings the CPAP back? And they just kind of look at me blankly like, I don't know. So I even offered to give them a demo as well. But I have had a few referrals from CPAP respiratory therapists because they're like, you know what, you're not going to get used to this, just go see Dr. Elliot. So it's kind of nice that people are open to what's best open to listening to their patient, I should say.
Well, Doc, I agree with you there regarding getting in the trenches. That's kind of how we operated at our lab, and our dentist actually came in and worked with the patients at night, and it was so awesome to see the actual titration with an oral appliance. But we are out of time, and we can't thank you enough. It was an honor to have you. We sincerely appreciate you coming here and talking to us and opening up our minds to dental sleep medicine. If people have any questions, where could they contact you?
I respond well to email, so Erin Elliot DDS @gmail.com. It's Erin Elliott DDS with 2 L's, 2 T's, and 2 D's. And I'm on Facebook and LinkedIn and Instagram, Erin Elliott DDS. And I hope I can come back on again to hear your perspective on appliances as well.
Most definitely. We might just have you come back on. So, but with that, we thank you so much for joining us. And to all our listeners out there and viewers, we thank you so much for your support. We ask you to continue listening, continue giving us the thumbs up if you're watching it on YouTube or on the audio platforms. Make sure you give it a 5-star rating. Don't forget to download, subscribe, do all the things that you need to keep it going, and share it with your friends. Until next time, thank you all, everybody. Lights on.